Good afternoon again, Ma'am Ho. My name is Michael Angelo Mendez. I am a second-year BSN student from Brookenshaw College of Davao. And in continuation to our perineal care, I'll be doing perineal shaving. Perineal shaving is the removal of hair from the surface of the skin, and the purposes of why we do this is to provide a clean surface and also to reduce the risk of infection. So this is recommended for patients who are undergoing labor, delivery, for pregnant women, also for male or female patients who will undergo perineal surgery or catheterization. So in our case today, I'll be doing perineal shaving for a male client, possibly for catheterization installation later on. So without further ado, I will give you the equipment and the materials that we'll be needing for this procedure. Okay, so for this procedure, we will need a razor. We will also need a flushing can with warm water. Let's say, for example, this is our flushing can. And take note that for our water, it should be 43 to 46 degrees Celsius or 110 to 115 degrees Fahrenheit. So it should be uh, warm, but not too hot and not too cold. We'll also need container with cotton balls. This is our container with cotton balls with soap sud solution. Two kinds of forceps, the pick up and the working forceps. We will need a bedpan or a Kelly pad, and we'll also need clean gloves. So I'm already wearing my, this is the gloves that we'll be needing, surgical gloves. So it's important that we assemble the materials and the equipment to save time and effort. And also, again, as a standard procedure, we have to wash our hands to reduce the risk of infection. And we have to introduce ourselves to the client and to state our purpose. This will help alleviate any fear or any anxiety and also to gain their cooperation. So I'll be doing the process of perineal shaving right now. Okay, to provide safety and privacy to the client, you need to draw the curtains in and also drape the... Oh, before you do that, you need to introduce yourself. So, sir, maayong buntag. Ako si Michael Mendez. Ako yung student nurse karon. And karon, sir, mag-shave ko sa imuhang kinatawo. Ang purpose ani, sir, is para limpyo ang imuhang kinatawo and also para malesen na tong infection niya. Dili ka magka-infection. Okay ra ba? Okay, pwede pakita sa imong armband, sir? Sa imong ID? Okay, thank you, Mr. Lopez. So as you can see, it's very important to state our name and our purpose and also to explain the procedure to the client so that the client will cooperate, and also this will lessen or reduce their anxiety or their fears. And after that, you need to drape the client. So pull the gown, the patient gown of the client above. And then for the blanket, what we need to do in order to prevent from soiling the bed, pull the bottom of the blanket upwards, exposing the genital part of the client or the penis. And also the bottom end sides, what we will do is we will just tuck it in the patient's legs like that. Okay? And with our towel, we will cover this part with towel. Okay, the next step that we are going to do is to flush the perineum and wet perineum before applying soap. So we need to put a bedpan like that. Remember, the client should be in a back lying position and or supine position. Make sure that the client is comfortable. And then with our water, flush the perineum, wet the perineum before applying soap. So let's say, for example, this has water, so we will gently wash the perineal area of the client. Okay, as soon as we're done doing that, make sure that the bedpan will collect all the droppings or the drip from the water. Okay? And next is with the use of our pick-up forceps. So we have two kinds of forceps. We have pick-up and working forceps. We will get cotton balls with soap suds solution. And this will be to clean the perineal area. So say, for example, this is our cotton balls. This is our pick-up forcep. Okay? So just get enough to clean the perineal part. No need to do the rule of 7. So put away your pick-up forcep and get your working forcep. Okay, some people have a container, but in other books they mentioned that you can use the cover of the cotton ball container as the container for your cotton balls with soap sud solution. So place it on the cover of the container, return pick up forceps, and get your working forceps. So this is now our working forceps. So this cotton ball has soap sud solution, so we need to work up a lather and loosen the dirt on the penis so that the water can penetrate and soften the hair. So what we can do is we can just gently grab the penis and then with strokes and then discard this one. Make sure that the penis is clean. Okay, and one tip also is to use firm strokes and do not repeat the strokes because we are working from the we need to maintain sanitation. Okay, so let's say for example that we have already washed the penis. So what we need to do is to shave the penis. So when we are shaving the penis, the degree that we will be using or holding the razor is 20 to 45 degrees. So not too flat and not too 90 degrees. So it's just 20 to 45 degrees. And with your other hand should be gently stretching or holding the penis. And when you shave, the direction should be from where the hair is and where it is growing. So if it's pointing downwards, then your stroke should be downwards as well. So example. Okay, and then we can pretend that we are shaving the scrotum. Alright, so just like that. And remember that the direction of the stroke should be the direction of the hair growth as well. And when we stretch the skin, what we are actually doing is to eliminate the wrinkles and smooth the skin so that we can accomplish the shaving. And gentle long strokes with razor held at 30 to 45 degree angle helps prevent cutting the skin. Make sure that it's just gentle and you're not really pushing it. So shaving in the direction of the hair growth helps minimize skin irritation. Now, once we are done, take note that the used razor should be placed or you need to put that away, and then we need to flush the perineum. So again, using our container with water, we need to flush the perineum. So let's say for example that we're already done and we are flushing the perineum. Make sure that there's no cut hair or any debris or any soapset solution that is still attached to the skin. And after that, we can make use of our we will need to discard this. We can make use of our towel to dry the skin. Okay, so for our aftercare, do aftercare, discard anything that has been contaminated, and then what we can do is assist the client to wear his or her underwear, and then if you can, you need to change the linens as well, but if it's not soiled, then you can still use the same linen. Okay, so the last part is to make sure that the patient is comfortable and to note any signs of infection, any swelling, any unusual findings, and then document it so that you can report it immediately to the doctor if there are any mass, any lesions, any discoloration, or any signs of infection like swelling or excoriation. And also make sure that you talk to the client and ask if how the client is feeling. So sir, kumusta mo paminaw? Are you comfortable? Okay na ka? Alright, so thank the client, and also that's it. That's for our perineal shaving. Make sure that you discard all the materials that have been contaminated, including your gloves, and to do aftercare of the materials that you'll still be needing later on. Okay, thank you.